fair to say for nearly everybody, most people, we've been through very challenging times following the COVID pandemic and all the other issues which are going on around us. We're a very small team here at Healthwatch Warrington, and I'd firstly like to congratulate our small team on the great work they've done in the community, working with our partners and putting this presentation together for you. So I'm going to hand over to our Chief Executive now, Lydia, who will go through the report, and then like she said, there will be questions at the end of the meeting. So over to you, Lydia.
Thank you, Chair. Okay, just going to go through the agenda. Hoping to complete this within an hour for everybody. So we're going to go through the highlights from our annual report. We will go through our finance for the year. We will mention our ICAS service. Then we will start our projects and we will talk about our rapid community response. Then Chrissy will come in and talk about our Cheshire Merseyside Cancer Alliance partnership work. And I will go through Children and Young People's report. And then we have a guest speaker, Marsh Place Director, and he will be talking about our work with them in partnership around the Children and Young People's Mental Health report.
Lydia, just before you go on, I did forget to mention that to let everyone know the meeting is being recorded, so we can upload it to our website after the meeting. So Brilliant. If anyone's got any issues about being recorded or anything, feel free to remove your faces from the video. So anyway, back to you, Lydia.
Thank you. Thank you. And then Chrissy will talk about our people panel and our virtual voices, social media, and then I'll chat about our Enter and View programme. And then Chrissy will come back on, talk about our volunteering masterclass with Healthwatch England. And then I'll talk about our priorities moving forward. And then we'll finish with some questions or comments from from everybody, basically. And then we'll have some closing remarks from our chair. Chrissy. Right, I'll just summarise that really. So we completed published six reports, and 3 of those were from our inpatient wards at Merseyside at Hollands Park in Warrington. And we did our sort of rapid community response report, and we also did 2 reports around our Enter and View programme around GP surgeries. There was an increase on people that who shared their experiences with us, and also people who came to us for advice and information around topics such as mental health and the COVID-19 pandemic. I'll just run through our finances. We do have a very small budget, but I'll go through what we had for the year. So funding received, which is our Warrington Borough Council local authority who host the contract for us, was 147,000. Additional funding was from extra commissioned work that we completed, and that was just over 26,000. And we had a small balance forward. So the total income for the year was 174,845. And the expenditure, staff costs, operational costs, support and administration, and the total expenditure was 167,262. So slightly under, got a little bit of a surplus to carry over. Okay, and this next slide is about our ICAS advocacy service, and we have one person dedicated 1 day a week within our contract to work with the complaints for Warrington, and it's an ongoing caseload really. These are just some of the figures around the quarters, and some of the themes are working around secondary care, so it's our local trust. But also I think there was one particular case around the Walton Centre. So it's a mixture of complaints. And this was our Rapid Community Response Report. Sorry, bear with me. Yeah, Rapid Community Response Report. And if I just tell you a little bit about Rapid Community Response to people who don't know what that is. So it provides an urgent, within 2 hours, assessment and support within 2 days for a short time to help people recover and retain independence. And the team is particularly important to the context around the COVID-19 crisis, because they may have helped people to remain at home, recover after a fall or an accident, and who otherwise would have been put at risk going to hospital, and help people avoid going into hospital or residential care unnecessarily, and help people return home more quickly after a hospital stay. So we were approached by the Rapid Community Response team, and we collated information feedback from several service users to give their experiences around the service. And that was work over 3 months that we did, and we had a cohort of 95 service users, and we obtained 75 out of those 95 around their experiences. Okay, and going forward, we can't really recommend much because there was a fantastic result of 98% feedback, which was really, really positive. A couple of the comments that were made was the main issue that we found was lack of knowledge of the service and the understanding that people can self-referral into the rapid response service. And many people wish they had known about the service, and others now have the information if needed in the future. Many people told us that the information they did receive was useful and helped them. However, due to the age of the patients, they had forgotten and hadn't relayed the information to their family members. So we've proposed a recommendation really that it may be useful to give patients a written update, and they can refer or share with their family. Okay, and over to Chrissy to talk about the Cheshire Mersey Cancer Alliance.
So the Cheshire Merseyside Cancer Alliance were approached by them, we were approached by them because they wanted a video explaining about the quality of life survey. They said that they wanted the messages to be put across that you are important, your experiences are important, and sharing the experience is important to make a difference. Sorry, I'm admitting people at the same time. The Cancer Quality of Life Survey is sent to people after about 18 months after the diagnosis. And the survey is asking for you to rate about your experience and your quality of life after a diagnosis of treatment. They also wanted it to be clear that there is a helpline to contact to get help and support to fill out the survey so that the voice can be heard. So I'm just going to show you now the video that we created for them. This is an updated video. Some things changed throughout the process, so they wanted a few things, minor little details changing, so we did that, and that's it for you, so enjoy.
Thank you, Chrissy. Moving on to our other project, which was our Children and Young People's Mental Health Report. And this was a 12-month project. So we received over 1,300 responses from our Children and Young People's Mental Health project. So this was a combination of surveys, one-to-one, and case studies. This report followed our first report on children and young people's mental health in 2020. So we were commissioned as part of the original recommendations to look at a larger cohort of experiences. And this is through the pandemic. So this is basically children, young people, parents, teaching staff, practitioners, other professionals, including GPs, around their experiences. We work with the voluntary sector who work with children and young people, and we also looked at the statutory services who provide mental health services. All the agencies and services are detailed in the report. So I'd like to hand you over to Carl Marsh, our Place Director for Warrington Together.
Hello everyone. That photograph made me jump then. I didn't know that was going to be in there, Lydia. I would have vetoed that if I'd seen the slides. Hello everyone. Can I just kick off by saying thank you very much for the invite. Lydia asked me to say a few things about this, but not in terms of the detail or the detailed response that we will make to this, but in terms of how we've approached it in terms of our partnership in Warrington. And it's worth setting the context and going back a little bit pre-COVID. So Healthwatch had done a report for us in on children and young people's mental health service, and it was quite focused. And it came to a thing called the Integrated Commission and Transformation Board, which is basically a commissioner forum. And then we took the recommendations, and then we worked with providers through our contractors, commissioners, to do a you said we did. And that was sort of how we used to work then. We work in a very different way now in terms of our partners, in terms of commissioners and providers. And it's really hard to see the split now between what we used to call purchasers and providers. And so the way that we approached this was that the request to do more of a detailed survey, because we knew COVID would be making a difference to the children and young people of Warrington in terms of their mental health, and also to the people that serve them in our schools and in our health providers and in our VCSE sector. So we went much more broader than we'd previously previously gone, and we agreed as partners that we would do that. So that wasn't just the commissioner saying we want to really work out what's going on. That was us as partners saying we would like to have greater insight to our services in the context of a major pandemic. And so we agreed that together, and we agreed that also through the Health Scrutiny Committee, which it sounds like quite an adversarial committee, that, but it's a partnership committee where we work together to get the best outcomes for the people of Warrington using the Warrington pound. So when the report came out, we looked at that again as partners. So this board that we had pre-COVID, which was mostly commissioners, has now morphed into what we call a partnership board. So the report went there first, and that's a partnership board of Healthwatch, VCSE colleagues, NHS providers, health and care commissioners, and elected members. And Lydia, I'm bound to have missed somebody out because I'm not looking at my notes, but if I have, then I apologise for that, and you can help me out and drop them in the chat. So we took the report there first in terms of the draft headlines of what it was telling us, and I have to say personally, I felt, I don't know, I felt quite sad, I think, because the word sad was used a lot. Young people were describing themselves as sad, and also the bit in there where young children and young people were saying, I'll be there for anyone to talk to me if they want to, but quite a large proportion felt they had nobody to talk to, and I think that sort of came out from providers of services as well. So they are the things that we are trying to address, and address that not as a commissioner putting something into a contract, but working out what are the things that we need to do differently to be able to get a different response if we run this survey again. So I'm going to look at my notes on this, because what we've done is we've taken this to quite a lot of fora to inform those fora of the response that we got, and also to start thinking about collectively what do we do differently. So it's been to the Warrington Together Partnership Board, I think twice now, Lydia, hasn't it? It's been to Health Scrutiny Committee. Yeah, yesterday we took it to
Yes.
a new fora that we've formed called the Clinical and Care Professional Leadership Forum, and that is clinicians, not just doctors, but clinicians across Warrington, including care practitioners. That's quite a new step for us, and we took it there to talk through some of the findings, and also to get them to help shape some of our response. And we've also taken it, as I said, to Health Scrutiny Committee. We've taken it to the senior leadership teams in the council, and also my senior leadership team in the Integrated Care Board in Warrington, the team that sits under me for the ICB in Warrington. We've taken it to our fora where providers and commissioners come together, not as a contractual thing, you need to sort this out, but as a how are we going to do things differently in terms of the recommendation that we see. So we're starting to shape our response. And one of the things that we want to do is, as we shape that, our response to this recommendation, is do that as we've done previously, is to do that you said, we did, so that we can work that through. Some of those things are in our gift to do quite quickly. Some of those things will take more time to work through, and there are people close to the detail of this working that through. We have committed to keep partners updated, and we'll keep Lydia updated through the partnership board and our frequent conversations, but happy to come back to this group at any time and bring some of my experts that are closer to it in my team so we can talk that through. Lydia, I don't know if I've missed anything out, but happy to take any questions if that's the convention.
Thanks, Carl. It's really useful. Yeah, I've actually mentioned to everybody, if we can take the questions at the end, or if they can put that in the chat, we can get back to you on that. It's entirely up to you, because I know that you've got another meeting to rush off to now, but hopefully that was of benefit to people. But I can hopefully answer some of the questions as well if they come up around that report.
Okay.
But thank you for your time.
And if I can see the chat and I see any questions that are relevant to me, I'll try and ping a response in if I've still got access to it.
Thank you. That's brilliant. Thank you, Carl.
Thank you all. Have a good meeting. Take care.
Thank you. So from that report, Healthwatch recommended 15 different recommendations, but if I can just summarise those, I won't go through all of them, but basically really just reflecting on what Carl had mentioned. I think we found it was the low level support. It was whilst children, young people were waiting on sort of the waiting list, that they didn't have any support. So that's something definitely that we've identified that we need to look at, early intervention, and also timely and consistent access to professional help for emotional and mental distress. And just to touch on what Carl mentioned as well, there was actually 30% of children, according to our survey, that had stated that they wouldn't speak to anybody if they were feeling low. So we felt, again, that was around information and support around young people about where they need to go if they need to speak to somebody. There's the neurodiverse children as well really struggled throughout the pandemic. Parents expressed how their anxiety around supporting their mental health with their children's mental health. And also teaching staff and practitioners really struggled as well, trying to balance their emotional well-being whilst caring for their students and also their clients. And over to Chrissy to talk about our virtual voices.
Thank you very much, Lydia. So our virtual voices is a opportunity for residents to have their say and provide constructive feedback on health and social care services in our town. Okay, so one of the best parts about virtual voices is that it gives you, you decide on the level of commitment. All that we require is that you're a Warrington resident and that you are over the age of 16. You sign up. Once a month, we send out a survey. If you fill it out, your feedback gets made, gets taken, and we are able to listen to your voice and feed it back to the services that you're talking about. But also it gives you a chance to win a prize, possibly for a local Warrington business. The idea about it was that we're helping Warrington, especially after the pandemic and everything. We wanted to help Warrington small businesses as well as Warrington residents at the same time. So the feedback is pivotal and in reassessing health and social care services, and it's benefiting thousands of people. So I'll just cut to the video, which explains it a lot better than I can right now. And
want to win prizes and have your say about health and social care services in Warrington? Join Virtual Voices. Virtual Voices is a new way for Warrington residents to have their say about health and social care services and the chance to win vouchers for local Warrington businesses. How it works? Go to healthwatchwarrington.co.uk/virtual voices. Enter your email address, postcode and age to sign up. Once or twice a month, on a Friday, a survey will be sent to your email address. Fill it out, have your say, and your chance to win. Sign up to Virtual Voices today.
That's just a little summary of how we explain what Virtual Voices is. This past year, we've worked with organisations and get valuable feedback on our priorities for 2022 to 2023, which we'll talk about later on. We got carers feedback on maternity services and the mental health we took some of that information as well. We sent it to our virtual voices to help with our children and young people's report. This year so far, we've already worked with the Health and Wellbeing Hub. We've worked with the Health and Wellbeing Survey and the Patient Experience team as well, which we are currently doing now. If you do want to join our virtual voices, it's easy to do. It's just go on our website and sign up, and we send over the surveys for you. As I say, it's completely up to you if you wish to take part that month, but if you do take part, you will be put into the prize draw. I just wanted to talk as well about our People's Panel, which is a offshoot of the virtual panel, and it's a panel to discuss and challenge appropriate work streams that are part of health and social care services. The panel discuss and challenge, where appropriate, work streams and are a part. Oh, I think I've copied and pasted it twice, apologies. And they meet monthly, so if you would be interested in joining the Pupils Panel, that information is on our website as well, and we'll be happy to talk to you about that. Going forward as well, we use our social media, and after the pandemic, we found it really valuable, and we've been building it ever since. So it's just a bit of information about how we've used our social media and website over the past year.
This year we have continued to grow our social media presence on Facebook, Twitter and Instagram. In 2021 to 2022, our social media engagements reached over 8,297 people. We reached 322,137 people. Across all platforms, we gained 452 new followers. Our top performing Facebook post was for our virtual voices asking for feedback on the Health and Wellbeing Hub. This reached over 5,523 people with just one post and 43 engagements. On Instagram, our post about changes to PCR tests in January 21 was the highest reaching post. Twitter users engaged most with our Children's Mental Health Week post in February 2022. Last year, we had over 16,029 views to our website. Over 51,000 pages were viewed, and our top viewed pages were the homepage with 10,944 views, and second place being our COVID vaccination page with 5,306. Going forward, we hope to continue to build our social media presence and increase our reach and following. In August 2022, we launched our new website, which is part of the Healthwatch England template. We hope that the new website is more user-friendly and will encourage more traffic.
Thanks, Chrissy. I'll just talk a little bit about our Enter and View programme. So the last 12 months we were focusing on GP practices, and that was put on hold partly around sort of COVID restrictions, but we have managed to visit several practices, and we also conducted 3 inpatient wards at Merseyside Warrington at Hollands Park, and all the reports are published on our website, and this year we are going to continue working with GP practices. Okay, and I'd just like to introduce Karen Dixon. Karen Dixon is our new Enter and View lead volunteer coordinator in a part-time role. So Karen, would you just like to say hello? Just introduce yourself briefly.
Yeah, thank you very much, Lydia. I'm having real difficulty with my internet, so if I cut out, I really do apologise. My name's Karen. I've got like over 40 years medical experience in various different positions. I came back from America like 3 years ago and found Healthwatch, and it's just the perfect role for me. I'm looking forward to working with all the volunteers and getting my teeth into this Enter and View. So thank you very much. I look forward to meeting you with you all. Take care.
Thanks, Karen. Okay, and part of the Enter and View, so we published 2 reports around the practices. One was for Chapelford, and we got quite a lot of information and experiences around Chapelford at the time, and also Helsby Street Medical Centre. Again, some information around Helsby, but I would just like to say, particularly Helsby was a very, very positive report. and they do work quite closely with Healthwatch as well. So that was for previous year.
Just like to add as well that we've got running throughout a survey where you can feedback on your doctor's your doctor's GP surgery, primary care, and you can feedback on your experience. We've got a great database that we are keeping in order to shape and our enter and view program. So if you do want that, we will put that link in the chat at the end. But it's a great way for you to have your say and help us to make a difference.
Thanks, Chrissy.
You're welcome. So back to me again. So we have our volunteer and masterclass. We were asked, we applied and were successful in offering a volunteer and masterclass, myself and Claire, for Healthwatch England, which is an opportunity for us to share our successes as volunteering managers and helping volunteers and recruitment and retention for the rest of the Healthwatch organisations to join on and find out. So we were asked to do that last year, and we were asked again if we could do it again this year, which we did. We updated it a little bit, and we'll be going on to do an e-learning module for volunteering, which is a great opportunity for us to share what we do, and that happens in December. So this was just a little information about what we did. We listened to people, we shared our ideas, we listened to their ideas as well. And we were able to make a infographic which helped everyone else just to get all the information down. We really love to celebrate our volunteers, and we do what we can to thank them and let them know how grateful we are, because without them we would wouldn't be able to do as much work as we actually do. So we were really grateful for them. And this year we offered a volunteer celebration, which was an absolute hoot, if I do say so myself. We had our lovely chair here presenting just an appreciation certificate and a bar of chocolate to say thank you. But we also had a little luncheon with some live music, which was lots of fun, got everyone up and dancing, and we had a great time. So we really are grateful for our volunteers and try and make them feel appreciated as much as we can.
Thanks, Chrissy. Okay, so moving forward, we had a public vote. Just wondering if this video is going to work. Yeah, so the priorities were chosen, and the 4 that were chosen were GP access, dentistry, adult mental health, and women's health. So part of the GP access, we will work again with our 12-month enter and view plan of local surgeries, and they are chosen through public experiences. We work with dentistry, which is, again, it's an ongoing subject, and continue to gather public experiences and work in partnership with Warrington Together at Place and to highlight any challenges. We work with adult mental health and continue to work in partnership with the mental health boards and work with recommendations for our parents and carers, which was evidenced in the Children and Young People's Mental Health Report throughout COVID. We will be working with women's health, and we're working at the moment on data from public health joint strategic needs assessment, and there is some information there around increased self-harm presentations at A&E for women. So we are going to look into that, and again, that's a partnership approach, and we will analyse that data. Sorry, Chrissy, can I just go back to that? Thank you. Yeah, analyse that data, and again, we will be working with the Suicide Prevention Board, Safeguarding and Mental Health Boards, and Women's Health. Again, we'll be working with the government's Women's Health Strategy 2022, but also trying to find out what's important to the women of Warrington. Looking forward to organising our Women's Health event in March. And we currently have a live survey on at the moment on our website. So we'd be really grateful of any women who would like to complete that, or certainly if you know of anybody, any other women who would like to complete that for us. And it's going to establish what areas of women's health that we are going to concentrate for Warrington. We will publish a full report on the findings, and we'll work with our quality leads and Warrington together to feed into service delivery. Okay, and I just want to mention as well the work that we've continued to work throughout the year with Signing Solutions and the deaf community around access to primary and secondary care in Warrington. So the report has been completed. We are due to publish that within the next couple of weeks. So again, that will be on our website and we will share that through our channels. And I think that comes to the end of the presentation. So I would like to open this up to any questions or comments. And again, if you'd like to raise your hands on the reaction button, and then we can go through, or alternatively, if you want to put anything in the chat box. But whilst we're just waiting, I just would like to start off, if I can say quickly, I just want to say a really big thank you to our chair, who's done really, really well, and he's helped us increase our reach for Healthwatch. Quick thank you to our HAB board, who have supported us and continually support us, and also our amazing staff team, who are very small but well formed, and again our volunteers as well, and the public who give us all their information experiences to help shape and improve services for health and social care in Warrington. Okay, so I think we may have a few. Chrissy, can you help with the sequence of hands? And obviously ask away who you'd like to ask the question to as well, if you've got any specific areas that you want to ask.
So just trying to look on my screen as much as I can. I've got Loz, who would like to ask a question.
It's not really a question, it's just to say, obviously I'm new to Warrington Disability Partnership, and it's wonderful to see the work that is going on in Warrington, you know, to support, you know, patients with the Healthwatch. Just think it's fantastic work, and what I've seen today, you know, it's really great to be invited to be involved. So thank you, that was great.
Oh, thank you. Thank you very much.
That's all right. Don't worry.
I've got Pat McGuinness.
Hi, similar to Lars, not a question, just some comments. Firstly, say wow. You know, what a difference you guys are making with a very small team, and obviously very supportive volunteers. So just tremendous well done to you all. I think from a Merseyside perspective, you know, I can't underestimate the support that you give us as an organisation, as a trusted, objective organisation that can help us link in with the users of our services and our patients and local communities in relation to trying to improve our services in terms of quality and satisfaction, and also just noting the amount of social media reach that you've now got, which is also a tremendous achievement, and I know you've been working on that, so just thank you so much for everything that you do.
Oh, thank you, Pat. Thank you very much for that.
I can't see any more hands raised or questions in the chat, so we shall move on. Bear with me. There we go.
Wow, I'm almost lost for words after that, and particularly for those remarks we've just had then. You've almost made a grown man cry there. It's been certainly been a roller coaster year, and I'd like to thank everyone for attending this meeting. And I hope you found it interesting information. There's been a heck of a lot of information to take in, and it's incredible that such a small team of 2,500 people really, and all the amazing volunteers have been able to put all that together and do all that work in the community. So big thank you to the members of the public who we work with and we try and help and support, for sharing your experiences so we can help make a difference in the community. And again, I mean, Lydia's already thanked the team, but wow, what an amazing team. I mean, I just can't say how hard these people work in the local community. Big shout out to our partners in the community as well. We're here to work with you and support you. Sometimes we have to be a critical friend and, you know, but we want to be proactive and we want to work together. And our main aim is to make Warrington a healthier place for us all. And what could we do without our fantastic volunteers? I mean, the volunteer event we had was amazing. I hope we can organise another one soon, so we can let our hair down and all enjoy each other's company. These virtual meetings are great. It's a good way we can all connect, but you can't beat face-to-face meetings where we can all meet and share experiences. It's clearly going to be another challenging 12 months. So it's more important than ever that we all stick together, we work together, and we try and make Warrington a better place and a healthier place by working as a team. So I don't know if anyone else has got anything else they'd like to add before we close the meeting. No? Have you all gone quiet?
I think so. Thank you so much for being here today. We will be, as we did mention before, that we did record the meetings. We will upload it onto our website for people to actually be able to see and come back to. We will make the presentation available for you, and please just remember that we have our surveys available, our virtual voices, and we would love for you to share them and help us to get as many voices heard as we can in Warrington.
I see Pat's got a hand up there.
Yeah,
Pat has her hand up, yeah.
Pat has got a hand up, so I couldn't get my hand up fast enough, so my apologies. I'm attending today on behalf of Warrington and Halton Teaching Hospitals, and may I add on behalf of the Trust my thanks to a small but beautifully formed team. Everything I'm at, you seem to be at. I don't know how you spread yourself so thinly. You are a critical friend, and we find working with you easy, difficult, but ultimately pleasurable, and we know that with your challenge that we're on the right track for our patients and their loved ones. So on behalf of the Trust, congratulations on a fantastic year, and look forward to working with you again next year.
Thank you, Pat.
Thank you, Pat. Thank you.
Anyone else want to say anything before we close the meeting? Well, once again, thank you all for attending and your support. And okay, well, thank you, everybody, and hopefully see you all soon.